So there's a new virus spreading in China, causing some alarm and even some panic. This time it affects kids. That's the one demographic that they couldn't get us on last time, right? People they found out maybe didn't quite care so much about the old people as much. So they're thinking maybe this time, if it goes after the kids, everybody will lock down. Let's just hope, knock on wood, that that's not what's going to happen. Well, here's the article that recently came out in DW. A sharp rise in respiratory illnesses, particularly among children, has sparked fears of a new virus emerging from China. As cold and flu season begins, Chinese authorities insist no new pathogens have been detected. They say, "Don't worry, no new pathogen." So the article goes on to say, China on Sunday. So this was written just 2 days ago. China on Sunday told local authorities to increase the number of medical clinics that can handle a surge in respiratory illnesses in the country. The call comes after China's National Health Commission 2 weeks ago reported a large increase in pneumonia cases, mostly in children. The report triggered memories of the COVID-19 pandemic, with social media users fearing a new virus coming from China or a new COVID. Yes, we're worried about this because it's deja vu 4 years later, right in time for an election season, almost exactly to the day. It's 4 years to the day nearly when the last China virus came around and ended up causing us, wreaked havoc on all of our lives. It says last week, the public disease surveillance system ProMed reported that some Chinese hospitals were overwhelmed with sick children. Do these words ring a bell? Overwhelmed with sick children. This outbreak was said to be mainly in the capital, Beijing, but also in the northeastern Liaoning province and other areas in China. So what did Chinese health officials advise? Quote, efforts should be made to increase the number of relevant clinics and treatment areas, appropriately extend service hours, and strengthen guarantees of drug supplies, National Health Commission spokesperson Mi Feng told a news conference on Sunday. Mi said the sharp rise in acute respiratory illnesses was linked to the simultaneous circulation of several kinds of pathogens, most prominently influenza. Symptoms, so this would be a flu, another flu, although they're saying they haven't identified this. Symptoms include, or they haven't diagnosed it. They're saying these are cases of pneumonia that they haven't diagnosed, so they don't really know. Symptoms include fever, lung inflammation without a cough, and pulmonary nodules, lumps on the lungs that are usually the result of a past infection. No deaths have been reported. China is facing its first full winter since it eased its strict zero COVID policy that forced lockdowns and quarantines to quell the spread of the virus. Several experts have pointed, now this is interesting, several experts have pointed to winter's arrival and the end of COVID restrictions and a lack of prior immunity in children as likely being behind the surging infections. So because China locked up their kids and the kids weren't able to go out there and actually catch diseases like kids do, they have a lack of immunity to disease. And now that suddenly the economy's opened up and China's no longer doing their zero COVID insanity, the kids are out and the kids are catching illnesses. So that's what happens when you destroy an immune system, right? When you harm an immune system. This is another one of those unintended consequences of the lockdowns. And we're seeing so many more of them as time has gone on, time after time after time. We keep seeing more and more of these unintended consequences. They said, no, this was for everybody's good. Lockdown. And many of us said, oh, this is going to end up in a disaster. This is a disaster. And there's going to be more disasters we can't even fathom at this point. Some ramifications from these lockdowns we can't even dream of at this moment. We just know the ones we know. But what about all the ones we don't know? Well, this is one that we kind of knew, actually, that if people aren't around each other and they're not circulating around their little germs, that they're going to have a weakened immune system and they're going to be more susceptible to stuff. So it goes on to say China's cabinet, the state council, warned on Friday of the risk of a rebound in COVID infections alongside influenza and mycoplasma pneumonia infection, a common bacterial infection that typically affects young people, which has circulated since May. All localities should strengthen information reporting on infectious diseases to ensure information is reported in a timely and accurate manner, the state council said in a statement. Earlier this week, now this is also interesting, earlier this week, the WHO called on China to provide more information about the surge in cases By Friday, the Geneva-based health body said no new or unusual pathogens had been found in the recent illnesses in China. So the WHO is saying, this is, again, deja vu, 4 years later, almost to the day, because they said that last time. Last time they said, no, there's no new or unusual pathogen circulating around China. And then there was a lot of accusations that the WHO was actually covering up for China and that they were working in cahoots. And there was some evidence of that. Because if you remember when the journalist was trying to question the WHO about Taiwan, and the minute they said Taiwan, it was like a pariah had entered the room, and suddenly the WHO head shut down all questioning and ended the conversation immediately with that person who was talking about Taiwan. So they're very in bed with China in a lot of ways, and perhaps helped cover up the last COVID. So I want to read this other article to you. This is from Zero Hedge. WHO recommends masks, social distancing in China amid mystery pneumonia outbreak. There's nothing to see here, says the WHO. There's no new pathogen, no big deal. But start social distancing and wear your masks. So the World Health Organization is recommending that people in China wear masks, socially distance, and stay home if they're unwell, as cases of an undiagnosed pneumonia has been detected in hospitals in Beijing and Liaoning. Okay, so this new virus could end up, maybe it won't be something where they feel like they have to lock us down for, but just right there, masks, and stay home and socially distance. So we're going to be living like this for the rest of our lives we might get sick, everybody, in the winter, because, in the winter we get sick. That's what happens. And they're going to say no holidays for you. No family get-togethers. Keep them small. No unusual or novel pathogens have been detected. Both China and the WHO have faced questions about the transparency of reporting on the earliest COVID-19 cases that emerged in the central city of Wuhan in late 2019. At this stage, there's nothing to suggest that it may be a new variant of COVID, said Bruce Thompson, head of the Melbourne School of Health Sciences at the University of Melbourne, discussing the preliminary data. So at this stage, there is nothing to suggest that it may be a new variant of COVID. So that would actually be a relief if it were just another variant of COVID, because we're all pretty used to it at this point, right? We've gone through how many different variations of COVID. At this point, most everybody's had COVID, whether you were vaccinated or not, or triple vaxxed or quadruple vaxxed, or, COVID, the vaccines did not stop the spread of COVID. People got COVID. And so people are less afraid of it because people have had it, they got through it, and they're no longer afraid of that unknown. So it'd almost be better if this were just a new strain of COVID. Most of us would just go, okay, yeah, right, I've had COVID a couple times, got over it. The last time it was really mild, okay. I'm building up my immune system. But when they say, oh, this is not COVID, and this is something else, and it's affecting kids, and they're overwhelming hospitals, this is what is going to cause that concern and panic. And I think a lot of people will not be panicked. I think the people who weren't panicked around COVID won't be panicked regarding this, but maybe because this time they're saying, but it's the children. It's the children. Before you could say, well, but the older people it was affecting, they were like on average 85 years old. I mean, we're talking about people who are already in nursing homes. They were already in hospice care. A lot of the people who died in the early bouts of COVID-19, but the kids, when it's the kids, that's a whole different story. They have their whole lives ahead of them. And so there's reason to fear because, of course, if you cut off the life of a child, you're cutting off 70, 80, 90 years of life. It's not somebody who's in hospice in a nursing home. So this is scarier when they say kids. I still think that most people are not going to be freaked out by this, but I think the people who are still freaked out by COVID, and there are many, they're certainly going to be freaked out by this. And unfortunately, many of them are in control. They're in charge. They run the government. And they run our local municipalities, and they want us to mask, and they want us to socially distance, and they want to do lockdowns and closures, and say businesses have to do takeout, and you could only do drive-by pickups. You can't go in and mingle. And we're going to see perhaps more rounds of this, especially those of us who unfortunately live in areas who are controlled by people who want that endless masking, have not come to terms with their failures when it came to managing the pandemic, and may be apt to do it again, so that this time they could hopefully be right and say, ha, I told you so. I'm vindicated. Meanwhile, the rest of us suffer, and most of us have been vindicated. Most of us that were calling out all of this from the beginning have been vindicated. But here we are again, rigmarole once again, 4 years later, almost to the day. It was what, I think it was first detected. December is when it first came public. Right after Thanksgiving, it became, or was it even around Thanksgiving? I'm trying to remember the exact day of when there's this virus in China and circulating around. People are passing out and dying. Oh no. And then suddenly by March, April here in the United States, we were in full blown lockdown. So let's hope that doesn't happen in the next 4, 5, 6 months, just in time for election season. But I wouldn't be surprised if that is what happens. Are you tired of being targeted with phishing emails, fed up with spam cluttering your inbox, concerned about companies like Google or the government spying on your private conversations? Then it is time to switch to StartMail. StartMail is a secure alternative to Gmail that lets you send emails like they're in a sealed envelope, making sure your communication stays private and secure. Services like Google collect your data and they use it for targeting ads. StartMail is a strictly ad-free service that does not collect or share any data with third parties for advertisement or tracking. Your StartMail account comes with all the features you need, including unlimited disposable email addresses to protect your inbox from phishing scams and hacking attempts. And switching to StartMail is super easy. So if you're worried about your old emails stored on Gmail or Outlook or Yahoo, well, they've got you covered because they have a hassle-free migration tool that lets you move your emails and contacts with just a few clicks. No technical knowledge required. So over the past decade, StartMail has become a trusted name in email privacy, and they have a great deal still going on, actually, for Black Friday, Cyber Monday. I love it when these things extend. So they are offering 50% off annual subscriptions plus an additional 3 months free. All you have to do is go to startmail.com/Iverson to sign up now. That is StartMail with a T, startmail.com/Iverson. And the offer ends November 30th. So what is that? That's in like 2 days. So don't wait. Go get your StartMail and start sending secure emails.